Hi, this is Josephine Ramos reporting. Our case presentation entitled Multiple Sclerosis. Client characteristics. A 58-year-old male with pain and tingling in fingers of the left hand, which progressed to arm and neck, and slightly blurred in vision on his right eye. His appearance is 165 centimeters in height, 65 kilograms in weight, and his BMI is 23.8 kilograms per square meter. Multiple sclerosis is a chronic demyelinating disease that affects the central nervous system, which includes the brain and the spinal cord. The myelin is the protective sheath that surrounds the axon of neurons, allowing them to quickly send electrical impulses. This myelin produced by oligodendrocytes, which are the group of cells that supports neurons. In multiple sclerosis, demyelination happens when immune system in appropriate way attacks and destroys the myelin, which makes communication between neurons break down. Ultimately, results to all sensory motor and cognitive problems. Now the brain, including the neurons in the brain, is protected from the things in the blood by the blood-brain barrier, which only lets certain molecules in cells to get through from the blood. For immune cells like T cells and B cells, that means that they have a right to log in to a surface molecules to get through the blood-brain barrier. Once the T cells makes the way in, it can be activated by something getting co-owners. In case multiple sclerosis, it is activated by myelin. Once the T cells get activated, it changes them both. And the blood-brain barrier also express more receptors. And this allows the mini cells to more easy ways to get in. Now, multiple sclerosis is a type of 4 hypersensitivity reactions, or cell-mediated hypersensitivity, and this means that myelin-specific T cells release cytokines, like interleukin-1, interleukin-6, tumor necrosis factor alpha, interferon gamma, which together allow to dilate the blood vessels, which allow more cells to get in. Each walls directly cause damage to be like on oligodendrocytes. These cytokines also attracts B cells and macrophage with primary reaction. These B cells that makes antibodies mark the myelin sheath. protein. And the macrophage use the antibody marker to engulf and destroy the oligodendrocyte. Without the oligodendrocyte, there was no myelin that can covering the neurons, and this way behind areas are scar tissue called plaques or sclera. In multiple sclerosis, these immune attacks could typically happen in bouts. In other words, our immune attacks in our oligodendrocytes might happen, and then the break regulatory T cells also come in, an inhibitor to come down, and the other mini cells within a reduction formation. Early on, multiple sclerosis be like the oligodendrocytes to heal. Extend out a new myelin to cover the neuron, which is the process called remyelination. Unfortunately though, over time, the oligodendrocytes die off and remyelination stops, and the damage becomes irreversible and the loss of the axon. The cause of multiple sclerosis is unknown, but it's linked about genetics and environmental factors, including female and having genes encoding specific types of immune molecules like HLA-DR2, which is used to identify and bind foreign molecules. Environmental risk factor includes infection as well as vitamin D deficiency, which is interesting one because it might help explain what other reason multiple sclerosis are higher in the northern and southern poles compared to equator where there's a lot more sunlight. Together, these genetics and environmental risk might have influence to the body not killing off the immune cells that target myelin. So there are four types of multiple sclerosis. Based on patterns on symptoms over time, to break this down using a graph which is time on x-axis lifespan of individual and disability on the y-axis. The first time and by further most common pattern of multiple sclerosis is relapsing remitting multiple sclerosis or RRMS. This condition is what we just described bouts on immune attacks is happening for months or even in years apart and causing an increasing of levels of disability. For example, during bout, a person might lose in vision, but then it might be followed by improvement if there's remyelination. Unfortunately, though, more often than that, remyelination process is incomplete. So there's of some residual disability that remain, and that means that each attack, more and more the central nervous systems get irreversible damage. In relapsing remitting multiple sclerosis type, there is typically increase of disability between bouts. So the line staying that during that time, now the second type is called secondary progressive MS, which is pretty similarly to relapsing remitting type. But over time, the immune attack becomes constant, which causes steady progression of disability. The third type is primary progressive MS or PPMS, which is basically one constant attack. On myelin, which causes steady progression of disability over person's lifetime. The final type is progressive relapsing multiple sclerosis or PRMS, which also one constant attack, but timer of bouts superimposed, which can mean disability happens even faster. Specific symptoms vary a lot from person to person, largely depends on the location of the plaques. In multiple sclerosis typically affects an individual between ages of 20 to 40. Symptoms related about to linger over a week and can linger for months without treatment. One common trio of symptoms is called Charcot's neurologic triad. That includes dysarthria, which is difficult or unclear speech, nystagmus, which is involuntary rapid eye movements, and intention tremor, dysarthria. Dysarthria, due to plaques on brainstem that affects fibers that controls message to the mouth and the throat, and these interfere with conscious movement like eating and talking, and also unconscious movements like swallowing. Nystagmus, due in plaques in the nerves controlling eye movements, plaques on the optic nerves can cause loss of vision in one or both eyes because of damage of the optic nerve, which is called optic neuritis. Sometimes there is blurring or the gray of the vision, or there might be a dark point in the center of vision. Additionally, there's change controlling eye movement. and eye movement can be pain or can be double vision, and the eyes no longer used in a coordinated way. Finally, intention tremor includes the plaques along the motor pathways in the spinal cord, which can affect outbound signals like skeletal muscle control, motor symptoms, muscle weakness, muscle spasm, tremors, and ataxia, which is the loss of imbalance and coordination. In serious cases, it can lead to paralysis. In addition, plaques in sensory pathways can affect the outbound signals like sensation from the skin, in which causes symptoms like numbness, pins, and needles, and paresthesias, which often with tingling feelings that might also be a painful itching or burning sensation. A case there can be a very specific symptoms like Lermit's sign, which like an electric shock runs down the back and radiates to all limbs. When the person leans bending the neck forward, plaques can also involve in autonomic nervous system, which can make the bowel and bladder symptoms and constipation and urinating continence, as well as sexual symptoms like sexual dysfunction. Finally, multiple sclerosis can also affect higher order activities in the brain, causing poor concentration and critical thinking as well as depression and anxiety. Typically, multiple sclerosis is suspected when neurological symptoms spread over space, which is determinable damage in location in the central nervous system as well as time. Meaning, separate bouts or flare-ups is about our mission. The diagnosis about multiple sclerosis is supported by MRI that shows multiple in central nervous system regions called white matter plaques, since this region can have a lot of myelin. Also, in cerebrospinal fluid, there might be a high level of antibody which indicates autoimmune process. Finally, a visual evoked to potential can be helpful as well to measure the nervous system response to stimuli. For treatments like no cure for multiple sclerosis, but there are medications that are particularly effective for relapsing remitting type because they lessen the severity of relapses and make them happen less frequently. The medications like cyclophosphamide, which is cells co-inhibitor, intravenous like immunoglobulin, can also be used to autoimmune process. In addition, plasmapheresis can be effective as well, which when the plasma filter to remove disease-causing autoantibodies, and chronic treatment for multiple sclerosis includes immunosuppressants like a combinant beta interferon, which decrease the level of primary cytokines in the brain and increases the function of regulatory T cells. The other immunodepressants actually block T cells from getting into the brain by interfering the cells molecules that was gateway as passage to the blood-brain barrier. Unfortunately, though, there are fewer treatment options available for progressive multiple sclerosis. Instead, often are targeted specific things to the manage specific symptoms. Everything ranging from depression to bladder dysfunction. Physical therapy and cognitive rehabilitation therapy can be particularly helpful with sensory, motor, and cognitive symptoms. Finally, there's also increase in a role of vitamin D as effective treatment. Adaptive equipment like cups with lids, scoop dishes, adapted utensils for eating, sock aids, reachers, and communication keyboards is also effective and particularly helpful with sensory motor and cognitive symptoms. Recommended diet for multiple sclerosis patients. Have a diet low in saturated fats and supplemented by omega-3 from fatty fishes and cod liver oil or flaxseed oil and omega-6 fatty acids from sunflower and safflower seed oil and passive evening primrose oil. Eliminate sugar, fructose from your diet. Keep a daily fructose intake of not more than 25 grams. Eliminate pasteurized milk and dairy. Eat plenty of raw foods, fruits, and vegetables. Optimize your vitamin D levels by getting regular sunlight exposure. Nursing assistant role on patients with multiple sclerosis. Maximize the performance of motor functions. Assist on activities on daily living, social, psychosocial, and air breathing circulation. Prepare a daily recommended diet for multiple sclerosis patients. And to decrease mortality and long-term disability, that is the goal. To reduce ongoing neurologic injury, to prevent progression of the disease, and to control relapses, to manage the signs and symptoms of multiple sclerosis. As a recap, multiple sclerosis is a chronic and progressive autoimmune disorder. In multiple sclerosis, the common pattern is relapsing remitting type, or immune disease that come and go, which each one is slightly worsening under overall condition. During the flare, T cells cause inflammation. on oligodendrocytes on the central nervous system, which leaves behind scars called sclera. Scars area of the myelinated neurons called plaques or sclera, which causes variety of symptoms depending on the location. Thank you for watching, directed by Josie Pinagal Ramos.